Before we begin, I want you to think about the last time you checked your blood pressure. You saw two numbers, one on top, one on the bottom. Maybe one of them looked fine, and that gave you a little peace of mind. Maybe you told yourself, my reading cannot be that bad because at least one number is still okay. But what if that quiet comfort is exactly where the mistake begins? What if the number you trust the most is not the number that is putting the greatest strain on your body after age 60? And what if this misunderstanding has already led many older adults to wait too long, act too late, and miss the warning that was right in front of them the whole time? Hello everyone, welcome back to Senior Health with Dr. Sarah Mitchell. Today we are talking about one of the most common and most misunderstood health readings older adults see all the time, blood pressure. Many seniors have had their blood pressure checked for years. Many have heard doctors mention the top number and the bottom number more times than they can count. But even now, there are still many people who do not fully know which number becomes more concerning as they get older and why that difference matters so much. Let's slow this down and make it simple, because this is where many people get the wrong idea. A blood pressure reading has two numbers because your blood pressure changes with every heartbeat. The top number is called systolic pressure. That is the pressure when your heart pushes blood out into your arteries. The bottom number is called diastolic pressure. That is the pressure when your heart relaxes between beats. So if your reading is 150/80, that means the pressure when your heart is pushing is 150, and the pressure while it is resting is 80. Both numbers matter. Both tell us something. But they do not always matter in the same way at every age. For many years, people were taught to look at both numbers together, and that is still useful. But as we age, the picture changes. That is where things start to become more important for seniors. And this is also where many older adults get false reassurance. They see a normal bottom number and think they are safer than they really are. Or they become frightened by the bottom number while missing the bigger concern sitting right above it. That confusion is more common than many people realize. Let me give you a real-life kind of situation that may sound familiar. A woman in her early 70s checks her blood pressure at home. Her readings are often around 164/72. She feels fine. She still cooks, walks around the house, talks to family, and goes through her normal day. She looks at that bottom number and feels encouraged. She says to herself, at least the lower number is good. Maybe I do not need to worry too much. She does not feel pain. She does not feel weak. Nothing dramatic seems to be happening, so the urgency never arrives. Week after week, month after month, that top number stays high, and because she feels normal, she keeps putting off a serious conversation about it. Now think about another person, maybe a man in his late 60s, whose reading is closer to 130/92. He feels anxious because the lower number is higher than he expected. He starts thinking that something must be very wrong. He may even lose sleep over it. He tells family members he is worried about his heart. But in many older adults, that pattern may not carry the same level of danger as a much higher top number that keeps getting ignored. So one person feels calm when more caution is needed, and another feels alarmed while focusing on the wrong part of the reading. That is why this topic matters so much. And this matters even more because high blood pressure often does not make noise in the beginning. It does not always announce itself. You do not always get pain, dizziness, or some dramatic warning that tells you something is wrong. Many people feel normal right up until the day something serious happens. That is why blood pressure can be so deceptive. The body may look steady on the outside while pressure keeps building quietly on the inside. So now let us come to the question many older adults are really asking. After age 60, which number deserves closer attention? For most seniors, the top number, the systolic pressure, becomes the more important number to watch. But do not rush past that answer, because the reason behind it is what helps the lesson stay with you. If you only hear the answer and miss the reason, there is a good chance the old confusion will come back later. When we are younger, our arteries are more flexible. They can stretch more easily when blood moves through them. That flexibility helps soften the force of each heartbeat. But with age, those arteries become stiffer. They do not expand the way they once did. So when the heart pushes blood forward, the pressure rises more sharply. That is one reason the top number often goes up with age. At the same time, the bottom number may stay normal or even drift lower in some people. and that creates one of the most misleading blood pressure patterns older adults can have, a reading where the lower number looks fine while the top number keeps climbing. This is where many people get the wrong idea. They think a decent-looking bottom number means the whole reading is less serious, but that is not how it works for many people over 60. A high systolic reading can keep placing repeated strain on delicate blood vessels in the brain, the heart, the kidneys, and the eyes. It does not happen all at once. It happens one heartbeat at a time, one day at a time, 1 month at a time. That is why people often miss it. They are waiting for one huge sign, while the body has been under quiet pressure for years. Let me make this even more real. Picture a grandmother who loves taking care of her garden. She wakes up early, waters the plants, makes tea, and still feels proud that she can do so much on her own. At every check, her top number is a little high, but because she still feels active, she tells herself it cannot be that serious. She keeps saying, "I feel okay, so maybe it is not urgent." Then one morning, she has trouble speaking clearly. One side of her body does not feel right. Suddenly, the problem that felt small for months becomes impossible to ignore. That is the danger of waiting for symptoms. By the time the warning feels real, the pressure may have already done its work. Now picture another older adult who gets nervous every time the cuff tightens around the arm. The reading comes back a little high in the clinic, then lower at home, then different again the next week. That person starts to feel confused and maybe even helpless. They do not know which reading to trust. They hear different advice from friends, family, videos, and articles, and slowly they stop knowing what to focus on. If that person only watches the bottom number and ignores a top number that stays high again and again, that confusion can become dangerous too. So what should you take from all this? Not fear, not panic, clear attention. If you are over 60, you should not ignore the top number on your blood pressure reading. You should not wave it away just because the bottom number looks better, and you should not assume feeling fine means everything is fine. That is where delay begins, and delay is often what turns a manageable warning into a serious event. But there is another part here that many people need to hear. A high systolic number does not mean your future is already decided. It does not mean a stroke or heart problem is guaranteed. It means your body is giving you useful information, and what you do next matters. That is why the next steps are so important, and this is where the story can still change. First, know your numbers and watch them over time, not just once. One reading can be affected by stress, poor sleep, rushing around, or even feeling nervous in a clinic. But a pattern is harder to ignore. If your top number keeps running high, that deserves attention. Write it down. Keep a small record. Bring it to your doctor. Let the pattern speak clearly. Second, do not let a normal-looking bottom number distract you from a high top number. This is one of the most common mistakes older adults make. They celebrate the number that looks better and overlook the number that is carrying more weight for their age group. That misunderstanding can delay action for months or years. Third, work with your doctor, not against your doctor. Ask simple, direct questions. Is my top number too high for my age and health? Do you want me to track it at home? Do I need changes in food, activity, or medicine? What should my goal be? These are smart questions. Clear questions often lead to better care. Fourth, pay attention to the daily habits that affect blood pressure more than people think. Too much salt, too little movement, extra weight, poor sleep, stress that never settles, and inconsistent medicine use can all push things in the wrong direction. Small, steady changes matter. A short walk most days matters. A better routine around meals matters. Taking medicine the way it was prescribed matters. These things are not dramatic, but they are powerful over time. And let me say something gently but clearly here. If your doctor recommends blood pressure medicine, that is not a sign you failed. Many older adults quietly feel disappointed when medicine becomes part of the plan. But medicine can be one of the ways the body gets help before damage builds further. It is not weakness, it is support. What matters most is finding a plan that keeps pressure better controlled and fits your life safely. There is also a belief I want to correct, because it sounds harmless, but can lead people in the wrong direction. Some older adults say, blood pressure always rises with age, so maybe this is just normal. It is true that the body changes with age. But normal age-related change and safe neglect are not the same thing. A high systolic reading should not be brushed aside just because someone is older. In many cases, careful treatment and better daily habits can lower risk and help protect independence. And that brings us to the practical part many viewers really need. What should you do this week? Not someday, but this week. Check your blood pressure if you have not checked it recently. If you already check it, look back at the top number, not just the bottom one. If the top number is staying high, make an appointment or raise it at your next visit. If you already have medicine, take it regularly and do not change it on your own. If you have a home monitor, use it properly and keep notes. If you do not have one and your doctor thinks home checks would help, ask which kind is best for you. And if you are feeling confused by mixed readings, do not sit with that confusion for months. Bring it forward and ask for help. Do not wait for the day your body forces you to take this seriously. Do not wait for the moment when words feel hard to say, when balance changes suddenly, or when chest discomfort makes everything feel different. Early attention is quieter than emergency treatment, but it is far kinder to your future. So let me leave you with this one clear takeaway. After age 60, a normal-looking bottom number should not make you careless about a high top number. That top number deserves respect. It deserves follow-up. It deserves action when it stays high, because the real danger is often not the reading people fear most, but the reading they got used to seeing. Thank you so much for watching Senior Health with Dr. Sarah Mitchell. If this video helped you look at your blood pressure in a new and more useful way, please like, subscribe, and turn on the bell so you do not miss our future health updates. This video is for education only and is not a substitute for personal medical advice, so please speak with your doctor or healthcare professional about your own care. Please take care, stay safe, and may you have better health, more peace, more comfort, and more strength in the days ahead.